Cranial cruciate ligament ruptures are very common in dogs. They happen at a young age in many cases. They will happen frequently in both knees over the course of a couple of years, and they can be very debilitating to the pet's ability to go out, run, and be active. And over the course of a lifetime, that pet can develop arthritis that becomes fairly debilitating. Fortunately, in veterinary surgery, we have come up with a number of ways to make those patients better. And we can do a surgical intervention in most cases that will give them a far better prognosis than if it was left untreated. We want to do everything we can to give that patient the best possible experience so that their long-term outcome is excellent, but their short-term experience has the least discomfort as possible. We have selected procedures and implants, specifically titanium alloy implants that we use for those procedures, that are going to reduce as much as possible the risk of an implant failure, but also reduce as much as possible the probability of infection following surgery. And we do that by integrating a lot of the things that you would see in a human orthopedic center, including arthroscopy, including a full surgical team to be sure that the suite and the implants and the equipment, everything is working in the favor of a positive outcome. The procedure doesn't just stop at the operating room door. It extends into the hospital for the recovery of that patient, to give that patient the least anxious, best, and most comfortable recovery it can have. And also, we follow up with the rehab department and the surgery department to be sure we're getting what we expect. And we can assess if we're not getting what we expect, is there something we can do to improve that outcome?
We've got all of the facilities set up. We have all of the dedicated equipment here. We use arthroscopy, so we do a minimally invasive approach to look inside the knee and confirm what's going on and see what's going on. And there's certainly good evidence to show that when we use those techniques and use those tools, we're finding things that we might have missed in situations if we hadn't had those available.
If a patient has a cranial cruciate ligament rupture or may need knee surgery, all of our clients get to have a discussion with the board-certified surgeon before making a choice to do the procedure. At that consultation, the surgeon will evaluate that patient to give an assessment of what the best possible treatment plan would be, and to explain to the client as thoroughly as possible what to expect, what the goals of the treatment are, what their options are, whether there's a non-surgical treatment for that patient, and help them make an informed choice as to whether or not this procedure is appropriate for their pet and for them, but also to explain what the outcome is going to be and how the recovery is going to go. And our surgeons are here throughout the recovery, so we expect to not only do the surgery and do the consultation, but also to see that patient until it's better. And so one of the things that we do is we include the consultations and the x-rays of recovery throughout the recovery as part of the initial cost. There's no additional cost to come back to make sure that things are going as well as we expect, and for us to assess that. And so through our surgery department, if there's been a knee surgery that's been done here, we stand behind that. We want to make sure that the outcome is what we expected. And a lot of that is at-home care, and we explain that as well as we can to the client. We answer questions once they get home. If you have questions and you're at home and there's something that was not clear, you can call us and ask. But part of the recovery to get that patient back to its full potential ideally involves working with our rehabilitation department. Our physical therapists and our surgeons can interact as far as the outcome of that patient and make sure that the rehab is tailored appropriately to its recovery, but also if things aren't on track during the recovery, the physical therapist and the rehab department can immediately go and interact with the surgeon to be sure that the outcome is what we expect.
I had to do surgery on my dog's own knees, and going through that, I mean, it was great for me because I just brought them in once a week and they'd go over to rehab, and I think certainly to see that and see that benefit was really good. And it's really nice to be able to tell clients, look, there's a demonstrated benefit to rehab. We have it on site. You want to do it? We'll start it the day after surgery. And I think, again, I think that really helps them out in terms of both their long-term recovery, which is really important in terms of how they're going to do years and years down the road. But we see those guys when they're back for their rechecks at 2 weeks and 6 weeks, they're just that much further ahead when we've done the rehab. So.